Fentanyl Abuse by Taylor Willis, Professor Cianchetti for Pharmacology 428. What is fentanyl? It is a synthetic opiate drug that is approved by the FDA for use as an analgesic and anesthetic. It is 100 times more potent than morphine and 50 times more potent than heroin. It originated in 1959 by Dr. Paul Janssen and the Janssen Company of Bercy in Belgium. It began being used intravenously in the 1960s. The transdermal patch was introduced in the 1990s, followed by the buccal lozenges that were introduced in the late 1990s. Fentanyl forms of dosage. Parenteral injections are used in perioperative settings and to sedate. Roughly 0.1 milligrams equals 10 milligrams of morphine. Transdermal patches are used for chronic pain, such as the pain cancer patients endure. They're difficult to titrate and take 6 to 12 hours to reach a state of steady pain control. They last about 72 hours. Buccal stick lozenges are absorbed through the oral mucosa. There are two different types. One comes on a stick and the other is just a tablet. They both must be on around-the-clock opiates. And on this slide, we have a chart showing us the onset of action, the dosage strengths, the bioavailability, and administration time requirements with every route of administration of fentanyl. Fentanyl in the brain. The drug molecules will attach themselves to plasma proteins and fat cells in the body. Then these components are carried up to the brain where it binds to opiate receptors that will affect your breathing and slows it down before you even realize. Fentanyl is completely nonpolar and lipid-soluble structure allows easy passing through the blood-brain barrier. I have a little video that kind of explains it a little better.
Fentanyl is not a new drug, but has seen such a dramatic increase in the past 3 years that it has become a crisis in North America. Simply touching it may cause you to overdose, so what exactly does it do to your brain and body? Fentanyl is an opioid that can inhibit pain signals in multiple pathways along the brain and spinal cord. This is why it was initially prescribed for pain relief. It also causes your brain to make extra dopamine, creating sensations of intense euphoria and relaxation. Essentially, fentanyl hijacks your body's built-in system of endorphins by binding to your opioid receptors much in the same way your endorphins do, but at a significantly stronger level. This might sound fun, but activating these receptors can also suppress your brain's ability to detect CO2 levels in the body, potentially causing a person to stop breathing. On top of this, side effects include dizziness, chills, vomiting, fainting, difficulty urinating, and extreme constipation. In addition, fentanyl is much stronger than other opioids, 100 times stronger than morphine and 50 times stronger than heroin. For many drugs to work, they need to pass the blood-brain barrier. This barrier allows small fat-soluble substances to pass and water-loving molecules to be inhibited. Both morphine and heroin are lipid-soluble, but they have polar, water-loving groups that make them pass the barrier much more slowly, whereas fentanyl is extremely nonpolar and fat-soluble, entering the brain within seconds. This means you only need tiny amounts to get high, and that's where, in part,
long-term use of fentanyl can lead to loss of white matter in the brain, which affects your emotion regulation, your reaction to stress, and your decision making. Central nervous system can become depressed as the production of norepinephrine is decreased in your brain. This will affect your body's fight or flight response. This neurotransmitter is responsible for increasing alertness, blood vessel constriction, and your sleep-wake cycle, mood, as well as memory. Fentanyl addiction. High potency gives it an incredibly low number as its lethal dose of just 2 milligrams. This would be equivalent to 2 grains of salt. There is a high addiction risk to this drug because of its potency. Patients that are prescribed any form of this drug need to be monitored and kept in counseling to prevent addiction. Your brain works on a reward system, which is why it becomes difficult to kick addiction. You ultimately ruin your brain's reward system, which causes your brain to produce less natural dopamine because you are continuously giving it an easy alternative, which is why users can become depressed. This drug floods the brain with dopamine and creates extra dopamine. A tolerance is built after continued use. Hi everyone, it's Taylor, and I'm going to give you a visual on the amount of synthetic opiate overdose deaths. In 2011 to 2012, we had around 2,600 deaths. That's what that looks like in rice. 2,600 lives in rice. Over the span of 2013 to 2021, we lost 68,000 lives to synthetic opiate overdose. Fentanyl abuse history. Legal fentanyl products manufactured in the United States are stolen via theft, fake prescriptions, and even illicitly prescribed by medical professionals. Fentanyl is a cheap way to add potency to street drugs. Dealers add it to save money and earn more profit. Most users are unaware that they are using fentanyl, thinking they are using something else. Foreign countries also play a role in the illegal fentanyl distribution, such as China and Mexico. Reports from 2018 state that in 2016, 668 kilograms of fentanyl powder was seized in the U.S. from China. Illicit fentanyl. Street names include Apes, China Girl, Chinatown, Dance Fever, Friend, Goodfellas, Great Bear, He-Man, Jackpot, King Ivory, Murder 8, Poison and Tango, and Cash. The street cost is about $150 to $200 per gram. Illegal consumption routes would be snorting or sniffing, a pill or a tablet, spiked on blotter paper, patches that are cut up or ingested. These can be alone or mixed with heroin. Their fentanyl is put into fake pills to mimic other drugs. It can be put into an eyedropper form, a nasal spray. The possibilities are quite endless. The effects of fentanyl to the body. It gives a relaxation and euphoric feeling. It provides pain relief. It also can be used to sedate. It causes confusion, drowsiness, and dizziness, alongside nausea or vomiting, as well as urinary retention, pupillary constriction, and respiratory depression, which can lead to death. An overdose would look like a state of near unconsciousness. The person would have small pupils, clammy skin, possibly in a coma, respiratory failure, slow or weak breathing. Their body would be limp, discolored skin, especially in the lips. Choking and gurgling sounds could also be a factor of an overdose. Naloxone is used to treat overdose by blocking your opiate receptors, which is shown in the picture included.